Well, the medical treatments were a blood pressure medication, vitamin E or Pitaba, or surgery, which is invasive and complicated and oftentimes causes more problems.
Surgery works, but it has risks, and we're pretty slow to recommend it. Was that your experience?
Yes.
But what I love is that there is a new treatment option available.
Oh, absolutely, yeah.
And Justin, this is one that you have now had.
Yes. I was in a clinical trial for a new treatment.
Yes.
And I noticed immediate success.
Yeah.
Tell us about
immediate
this, Dr.
success.
Spitz.
Well, Justin, you full well, I'm sure, know now that you were very lucky.
Hey, it's awesome.
I was going to say, you were lucky to get into the trial. Not lucky that it worked, because it actually works very well. I was one of the clinical trial physicians, and the treatment is called Xiaflex, and it's made by Auxilium. We've been waiting for it for years, and the FDA just recently approved it. What it is an injection. It's an injection into the scar rather than a surgery on the scar. So rather than having to make any, very minimally invasive. The needle is tiny. It's like an insulin type needle. The quantity of medicine that's being injected is 1/4 of a cc per injection, but it's given in a series of treatments because this is a tough scar tissue, and it takes a bit of time to break it down. It's not one shot and you're done.
So you're literally breaking up that collagen, which is the scar tissue, allowing the erection to no longer curve and get back to its normal.
So it's a medication
straight shape.
that breaks down scar.
What it is actually is it's a derivative from a bacteria, from a Clostridia, and this derivative from this bacteria is what the bacteria would use to break down tissues that it was invading. And so they've harnessed the ability of the bacteria to break down tissue, to break down the tissue we want to break down.